Dr. Ravi Salgia. I'm the Chair of Medical Oncology and Therapeutics Research at the City of Hope. There's been a lot of exciting data on lung cancer presented at ASCO this year, and also going on at the International Lung Cancer Meeting, the World Lung. And I'm going to be talking about immunotherapy and how we've made strides in immunotherapy in the context of looking at the FDA data set, where one looks at greater than or equal to 50% PD-L1 expression, and seeing is there a differential in terms of looking at giving chemotherapy and immunotherapy or immunotherapy alone. And the conclusion is that for the elderly population, the older population, immunotherapy alone may be sufficient, as long as you have the high PD-L1. We also will be talking about KRAS mutations and KRAS wild type, and looking at the FDA data again for who responds to immunotherapy. And it seems like it's agnostic for the wild type as well as mutant KRAS. I will then talk about immunotherapy in combination with ramucirumab, where if you fail something like pembrolizumab or progress beyond pembrolizumab, can one combine pembrolizumab with ramucirumab? And the answer is yes. And there's a lot of data and excitement regarding that from the SWOG study. Then I'll be talking about targeted therapy in terms of EGFR. What should one do beyond osimertinib? And it seems like amivantamab with lazertinib is a good option, hopefully for the future for our patients beyond osimertinib for EGFR mutation, such as exon 19 deletion or L858R and exon 21 for EGFR. KRAS mutation is another topic that I'll be talking about. It's really exciting for us to see that G12C KRAS mutation, it can be targeted with agents such as sotorasib and adagrasib. And adagrasib has a durable response and an overall response rate. As well, it can penetrate the CNS. And finally, I'll be talking about looking at, should one get neoadjuvant therapy? And should you give 2 cycles of neoadjuvant therapy with immunotherapy or 3 cycles? And it appears that 3 cycles of neoadjuvant therapy may be more efficacious than 2 cycles of neoadjuvant therapy with chemotherapy and immunotherapy. And then finally, looking at combination of chemotherapy with immunotherapy and giving pathologic complete responses, that is quite exciting for us in our non-small cell lung cancer for early stage disease.